Hi, my name is Fihima. We also have Joel and Mishtari here, and we'll be talking about anorexia nervosa. We will begin the presentation by introducing anorexia nervosa, talking about its characteristics, symptoms, causes, treatments, as well as mention evidence-based research about the topic and the media's portrayal. Anorexia nervosa is defined as self-induced weight loss or insufficient weight gain that's associated with an irrational fear of gaining weight, or in more simpler terms, it basically means when an individual has unrealistic perceptions of their body. Although anorexia nervosa is categorized as an eating disorder, it really isn't about food. Many people with anorexia nervosa equate fitness with self-worth or coping with emotional problems, as well as many don't want treatment because their desire to remain thin overrides health concerns, which can be life-threatening. The most common characteristic in individuals with anorexia nervosa is a thin appearance. Many individuals stay thin through dieting, fasting, exercising excessively, starving themselves, as well as binging and purging. And binging and purging are similar to those with bulimia. They may also cover up in layers to cover their body, and they don't like eating in public. Other characteristics would be sunken eyes, thinning of hair, as well as bluish discoloration of fingers. Anorexia nervosa consists of physical symptoms as well as emotional symptoms. Some physical symptoms are fatigue, low blood pressure, constipation and abdominal pain, abnormal blood count, and abnormal heart rate, and in the female population they would notice an absence of menstruation. Some emotional symptoms include seeing themselves as overweight, lack of emotion, repeated weighing or measuring the body, as well as this intense fear of gaining weight or becoming fat. Now we are going to move on to the possible causes to anorexia nervosa. Anorexia nervosa and other eating disorders are commonly found in cultures and settings where being thin is seen as desirable. These include post-industrialized, high-income countries where fashion trends, sale campaigns, and media often present thinness as a desirable or typical trait. These are seen in modern Western cultures that idolize thinness and believe thinness comes with success and worth. Environmental causes are also like peer pressure, which happens among young girls. Another environmental cause is transitions, for example, a transition to a new school, a new home, a new job, as well as a breakup or death and illness of a loved one, which leads to emotional stress and increases the risk of anorexia nervosa. Psychological causes include having obsessive-compulsive personality traits. This is because it actually makes it easier to stick to an unrealistic diet and forgo hunger, as well as high levels of anxiety because it leads to extreme drive for perfection, as well as experience any wide range of psychiatric disorder. There is no one true cause of anorexia nervosa. However, there are theories that are categorized into environmental, psychological, and biological causes. Biological causes include having a genetic tendency toward perfection, sensitivity, and perseverance, as well as the family and twin studies reveal that anorexia is more prevalent in families with obsessive, perfectionist, competitive traits, and possibly autistic spectrum traits. The treatments that I will be mentioning in this presentation is cognitive behavioral therapy, interpersonal psychotherapy, and specialist supportive clinical management therapy. There are other treatments such as group therapies, nutritional treatments like dietary counseling, nutritional advice, as well as family therapy, but the three that I will be presenting today are the most common. Cognitive behavioral therapy is divided into 4 stages: the improvement of motivation, targeting cognitive distortions and dysfunctional behavior about eating regime and weight, issues beyond eating and weight, as well as relapse prevention. Patients with anorexia nervosa show cognitive deficits. That's why this form of therapy focuses on mental exercises aimed at improving cognitive strategies and thinking skills. They go about this by performing psychological tasks, puzzles, games, and other real-life activities that addresses cognitive flexibility and or central coherence. Cognitive flexibility is the ability to shift or change mental and behavioral strategies. Many people with anorexia nervosa have a lack of cognitive flexibility due to the fact that they have rigid rules and routinized behaviors. So this form of therapy basically leads to change the routine. And it starts off something as simple as brushing their teeth before getting ready for bed, changing different brand products from one shampoo to another, or sitting at a different seat on a dinner table. Thus, this leads them to be willing to try more foods, balancing their entire meal plans and not carrying on the nutrient makeup of a single food. This helps the patient understand the process of thinking and reflect on drawing parallels to behavior in real life. Cognitive behavioral therapy has the potential to reduce treatment dropout, improve cognitive abilities, improve the quality of life, and reduce eating disorder symptoms. Interpersonal psychotherapy is the second form of treatment which is often combined with cognitive behavioral therapy. So this involves 3 phases. Identifying the problem. This is to exploring the client's history of relations and life transitions. The second phase is learning and implementing new and healthier strategies for dealing with the relational and transitive problems. And the last phase is the therapist and client's review on the progress they've made and the skills they've learned. This form of therapy addresses role disputes, which are problems relating to others, conflicts in relationships, or difficulties in forgiving someone. Role transitions, which are difficulty adjusting to a new transition in life. This could be something like the divorce of their parents, moving to a new city, becoming a parent, graduating from school, or getting married. Unresolved grief, which is when the individual has not moved through the grief in a way that it has negatively impacted his or her quality of life. And interpersonal deficits, which is causing problems in healthy relationships, isolating themselves and blaming others for their personal problems and avoiding conflict. Interpersonal psychotherapy guides the individuals to better cope with tension and anxiety and addresses underlying personal issues, targeting underlying factors that may be fueling the anorexia nervosa, and focuses on strategies for relationship improvement for greater self-esteem. Specialist supportive clinical management combines 2 aspects: clinical management and supportive psychotherapy. Clinical management can be defined as good quality care. It establishes a stable rapport and therapeutic relationship with a client, as that relationship promotes adherence to the treatment regimen. There's an open discussion about fears and prejudices relating to mental health care, and the clinician provides the patient and receives a good ongoing care and treatment. Supportive psychotherapy, as defined by Lester Labrowski, is a demonstration of support, acceptance, and affection towards the patient, emphasis on working together with the patient to achieve results, communication of a hopeful attitude that the goals will be achieved, respect of the patient's defenses, and focus on patient's strengths and acknowledgement of the growing ability of the patient to accomplish results without the therapist's help. This comes in 3 phases: the patient's orientation to the specialist supportive clinical management, identifying of target symptoms and goals for weight gain and normal eating. Second one is ongoing monitoring of the target symptoms and supportive encouragement. And lastly, discussing the issues related to the termination and the planning of future. So with this type of therapy, there is no fixed timetable. It is very flexible to the patient's preference. The focus is the treatment on weight restoration and improving the quality of life. We are now going to move on to the evidence-based research on anorexia nervosa. A systematic review was conducted to look at the effects of the treatments in the cognitive behavioral therapy, interpersonal therapy, as well as the specialist support clinical management. So what they've noticed that in the cognitive behavioral therapy, there was intermediate results. That means it did benefit, however, there was no significant difference between the 2 other treatments. Interpersonal psychotherapy had the poorest results post-treatment, however, the best results shown long-term after follow-up. And lastly, the specialist support clinical management had the best outcome post-treatment. Thus, through the systematic review, it is clear that the specialist support clinical management should be considered the treatment of choice in the first instance to promote early improvement, but useful to base approaches from the interpersonal therapy once the initial improvements have been made.
Now I will be addressing and analyzing a cohort study conducted in 2013 about the effectiveness of enhanced cognitive behavioral therapy on patients with anorexia nervosa. I have used the FICO criteria to illustrate all the main components of the study. The study consisted of 46 single Caucasian female patients aged between 13 to 17 years old. The sample size was recruited from clinicians and doctors that recommended patients who had anorexia nervosa based on the DSM-4 criteria. The intervention given to the participants was 40 sessions of CBTE over 40 weeks. These one-on-one sessions were 45 minutes in length. For the comparison, the study did acknowledge the purpose was to find an alternative to family-based treatment, also known as FBT. FBT has shown to be not as accepted by families and patients. Limitations of FBT included labor intensiveness, expenses, and results were not as significant. The results of this study showed improvements in weight restoration. The mean BMI after CBTE increased from the patient's initial baseline BMI from 2.86 to 19.8. Also, participants' BMI increased to approximately 20.1 after the 60-week follow-up period. Psychologically, patients showed a decrease in dietary restraint as well as weight, shape, and eating concern. There are pros and cons to this study which may hinder the validity and reliability of the study, which I'll be going into. The pros include the measurement techniques used, such as the Body Measurement Index Percentile. This is a very reliable measurement to use when comparing the weight of the participants before and after the treatment. This article is peer-reviewed, which means that it was written by experts and reviewed by other qualified experts before the publication even happened. This ensures that the information in the study is reliable and noteworthy. According to the data, this study did convey valuable physical and psychological results. Written consent was collected from parents or guardians as well as consent from the individual. This notion makes the study ethical since participants were underage and they were given the right to choose to participate. The number of participants decreased from 49 to 46, considering after the inclusion and exclusion criteria as well as the consent forms. The DSM-4 was used to diagnose individuals as having anorexia nervosa. This makes the study fair and valid, considering it is a reliable source. The exclusion criteria was mentioned in the study. This is a set of criteria that exemplifies certain subjects because if they were included, it may skew the results. Some of these criteria include having previously received specialist treatment for anorexia nervosa. There are a few cons to this study. Since this is a cohort study, it requires analysis of the outcome over a period of time. The problem with this would be losing participants along that period for many reasons. This is very important because it can influence the validity of the study. For example, some patients may have opted out because they had a bad experience from the intervention. Therefore, their results would be biased since it does not represent everyone in the study that was originally included. Since this is not a randomized experimental study, there is the presence of selection bias. Therefore, the results collected are not representative of the population in question, since there are individuals from all cultures battling anorexia nervosa as well. There was only 46 participants collected in the study, which can be an issue because researchers generally intend to have a large sample size. If the sample size is large, then they can say with a certain degree of confidence that it is representative of the population. Due to the fact that this is a cohort study, it is rather time-consuming until the actual results are obtained, which may play a factor in the feasibility of the experiment.
Now, we will be looking at an example of a media portrayal of the disorder, and I'll be giving a brief description of the portrayal as well as an analysis on how accurate the movie was regarding the disorder. The movie, To the Bone, follows the life of a 20-year-old anorexic girl named Ellie, who spends most of her life in different rehab programs in order to treat her condition and find a way to resolve all of the emotional and physical issues she has been facing over the years. But even after attending various rehab programs, she continues to lose weight over time and begins to feel like she is running out of options. Her parents finally decide to persuade her into joining a group home for youths led by Dr. William Beckham, who is referred to as a non-traditional doctor. The story mainly focuses on Ellie's battle with anorexia and the struggles she experiences during her journey. This movie gives us an idea of what an individual with anorexia might be going through and the barriers that are related to this disorder. Now, we will look at whether this movie was an accurate description of anorexia. We will also look at possible influences on stigma that were portrayed in the movie regarding anorexia. First, let's look at the positives in the movie. To start off, To the Bone was a good example of a portrayal of anorexia nervosa because it gave us some insight on the struggles that an individual with anorexia may be experiencing. And these struggles not only include physical symptoms, but also showed some of the emotional and behavioral signs and indications that are correlated with anorexia. Finally, the creators of this movie also hinted at possible reasons for the development of the disorder, which included her dysfunctional family, or in other words, the lack of communication and understanding between her father and stepmother, as well as her distant relationship with her biological mother. Ellie felt like there was no one around her to understand her feelings and what she was going through. Let's also look at some of the concerns on the accuracy of this movie regarding the depiction of an individual with anorexia. The first real issue with this movie was that it portrayed anorexia as a disorder that mainly affected young women, which is something that was portrayed in the group home, with all of the individuals with eating disorders being young females, with the exception of one young male. However, it is important to understand that anyone regardless of age, gender, size, or ethnicity can be susceptible to the disorder. There were also several reinforced typical stereotypes that were present regarding individuals suffering from anorexia. Certain scenes in the movie were also a bit hard to watch or could be triggering or offensive to some viewers with eating disorders. So I feel like viewers should be informed well before watching this movie. We hope you enjoyed our presentation on anorexia nervosa and how it can impact an individual's health and lifestyle. We looked at some of the main concepts regarding anorexia, such as its characteristics, the symptoms, some of the causes, as well as the possible treatment options that are involved with anorexia. Thank you for watching our presentation, and we hope that it was engaging and provided a better understanding of anorexia nervosa.